Hi everyone, let's start today's presentation on OSCEs for dental students. I will be analyzing chapter in Clinical Problem Solving in Dentistry by Edward Odells about an ulcer. So, before I begin, I would like to give this disclaimer. No feedbacks were used. Also, please don't ask all the questions mentioned in my slides. Pick and choose according to the scenarios you are presented with. Lastly, there will be ulcer pictures, so beware those with faint hearts. This presentation is helpful for students starting ORE MFDS prep. The task seems daunting but is doable. Have faith in yourself and the system. One of the several books to read in this journey is Odells, Clinical Problem Solving in Dentistry. My presentation is based on this book today. What I did today was I took out a chapter called Troublesome Mouth Ulcers. I read through the chapter thoroughly and I will assume you have read it already as well. If you haven't read it, I would strongly advise you to sit down, read it, and watch my video again. Let's assume you are in an exam situation and have been provided with this picture on your left. Patient's details may already be provided, example age, sex, oral hygiene status, medical and social history, including smoking status. But for learning purposes, let's assume nothing has been provided except this picture on your left. And you're in the exams. What do you do now? So before I dig deeper, let me do my introduction. I'm Saleha, born and bred up in Pakistan. I've started my YouTube channel and would love to have you to subscribe. I would be uploading some OREM FTS related videos in future, so do comment on my videos and let me know topics you'd like me to make future videos on. I will try to make this presentation to the point, short, informative, and entertaining, I hope. This is me on Instagram, so you can follow me on Instagram, or you can join my Facebook page, which is aimed at helping Pakistani and non-Pakistani dentists unite on Facebook. You are welcome to join this open space to help others. So getting back to where we started, I left you with an ulcer picture, an examiner or a patient in front of you. What will you do next? Let's rewind a little bit backwards. Read the question asked by the examiners before entering the station. Some stations may ask you to just take a history, while others may need you to take a history, give diagnosis, and make a treatment plan. So there could be a format they wish you to undertake, and you need to know exactly what is being asked and try to be on point within the given frame of time. History taking questions are asked by you to the patient and they help you to form a differential diagnosis from which you can come to a definitive diagnosis, formulate a treatment plan for management of patient signs and symptoms. OSCE exams will have a certain time. Example, ORE OSCEs will have 5-minute station, whereas MFDS will have 8 minutes. While practicing, make sure you finish comfortably within that period of time. So you need to be very well versed. MFDS, you get 2 minutes before entering the station or before entering the room, and you are allowed to see questions during your resting stages as well. So I would recommend you make bullet points during Royal College of Surgeon exams, whereas ORE format is different. For a tip, you could get a pen with a highlighter attached to the other end or the opposite end to it. It's just a suggestion. Pick and choose your questions. You may not have time to ask all the questions, so be precise. Empathy is very important. So if a patient says, I have an ulcer, you shouldn't have a big bright smile and say, great, where is it? You should pause and say, I'm sorry to hear about it. Just saying sorry will give you 1 point. Asking, do you have any questions in the end, and saying thank you also carry marks. And that's very true in real life too. Right, so for this presentation purpose, let's assume the examiners want you to ask questions to the patient for a diagnosis of his condition, that is an ulcer. And as I'm on my own, I will be enlisting all the possible questions I can think of after reading the chapter, which will help you formulate a history taking format. Uh, Use layman terms, that is, non medical, without jargons, easy to understand rather than difficult medical terminologies. Troublesome mouth ulcer questions. Where exactly are the ulcers located, which will give you an idea about the keratinized or the non keratinized mucosa? Is it the first time you're getting the ulcer? You can also reword this. When was the ulcer first time noticed by yourself? Are there any more ulcers in your mouth or elsewhere on your body? How big is your ulcer? 1 to 2 millimeters, pea size, coin size? Is it continuously present or does it come and go? How frequently do they come and go in a year? How long do the ulcers last? Is the ulcer round, oval, irregular shape? Some patients may know this, but others may not be able to answer these questions. Also, the picture provided in front of you, you can judge yourself as well by looking at the picture. Do the ulcers occur at the same time, or each ulcer appears at a different time? Or do you get multiple ulcers together? So these are all the questions that I've just asked, more in an elaborate form for you. You can read through it as well. You can pause the video and read through it. This is a picture of my daughter taken by me. I love doing creative photography as a hobby. She used to suck her thumb and now she stopped sucking, which is amazing. Do let me know in the comments if you have a hobby yourself besides dentistry. So let's continue with the questions again. Is the ulcer followed by blister or boil, or does the blister boil bubble come before the ulcer? At what age did you or family member first notice the ulcer? Is there anyone else in your family with similar condition? Any factor that makes the ulcer better or worse? Are these ulcers painful? Does the ulcer bleed? Is there a change in color, shape, or size recently? Do you have any fillings there or any sharp edges of appliance, example denture? Do you have fever? Do you feel under the weather? So again, these are the questions which have been elaborated, the same questions that I've just asked. You can pause the video and have a look. Recurrent apthous ulcers may need a few other questions like, are you anemic? Do you feel dizzy all the time? Do you have heavy bleeding from stool or menstrual bleeding? Do you have any tests for iron, or have you had any tests by your GP for your iron levels? Do you consume meat, vegetable in your diet? Do you have a balanced diet? Do you have diarrhea, constipation, abdominal cramps, blood in your stool, weight loss, or any stomach GI problems? Do you have any allergies? So for Behçet's disease, you can ask some questions like, do you have any ulcers anywhere else in your body? Arthritis? Do you have any stomach problems? Any clotting problems? For traumatic ulcers, you can ask about any sharp tooth, any filling next to the ulcer. Is your appliance sharp? Example, the denture or the orthodontic appliance. For erythema multiforme, you can ask about any kind of medications. Are you on any kind of medications or medicines? Do you have any hay fever? Do you have a rash on your skin? Or are your eyes irritated? So just for the purpose of eliminating cancer as a differential diagnosis, although this chapter is not about cancer, any ulcer that persists over 2 weeks, you need to do a referral as an urgent. You should generally ask patient about smoking, drinking, and betel nut chewing as well. So restart smoking. You should ask the patient about the smoking status. So if the patient says, "I recently quit smoking, and doctor, I think I should restart it as it is causing me ulcers," as a dentist, you should discourage him from picking up smoke again. And this book here says it very nicely. Quitting smoking can exacerbate symptoms, but starting to smoke again doesn't usually induce remission. I saw this very good flow chart which explains differential diagnosis beautifully, and I just thought it would benefit my presentation if I keep this. And it would be great if you can just run through it and keep this in mind. Right, do like, follow, and subscribe. I hope you enjoyed the slides and didn't fall asleep. Please do subscribe and leave a comment if you managed to stay awake till the end of my presentation. Very well done if you did manage to stay awake. You can follow me on YouTube, Sally Babe, Instagram, and on Facebook. And good luck for your future. Take care and have a great day.